Hello everyone, we are from Group 10 of SBP 3511 Health Informatics. Everything seems to be connected these days. The rapid advancement of the internet has created unmistakable significant changes to our everyday lives. Just imagine, 20 years ago we were so dependent on paper maps to travel places. Now we have the GPS to travel around the world. Every day the number of internet users are increasing and everyone is more connected. Did you know you can even connect to a doctor using technology? This leads to our topic, telemedicine. What is telemedicine? Telemedicine is a tool that allows patients to connect to physicians securely through the internet. Many different communities can benefit from the use of telemedicine, especially people living in medically underserved areas. Telemedicine provides accessibility to primary care and specialty doctors that may have been out of reach before. For example, meet Sanguji, a 9-year-old girl who lives in a rural area. Through telemedicine in the school nurse office, Sanguji receives primary care and specialty care without leaving the school. Thus, Sanguji becomes so happy because she do not have to travel to the city for treatment. Put simply, telemedicine is the practice of using communications technology to link healthcare providers to their patients and each other over great distances. Telemedicine manifests in a number of ways, all of them centered around data transfer and communications. The type of telemedicine include real-time telemedicine, remote patient monitoring, store and forward practices, medical imaging, and consultation.
Hi! Today we are going to talk about the application of telemedicine. Let's start. As we're facing the COVID-19 pandemic over the world, the access to medical services after a natural disaster is critical to public health. So one of the telemedicine applications is allow health workers to quick analyze and sort the victims. Moving to the countryside, one of the biggest issues in the rural healthcare is access to the healthcare services. So in this case, telemedicine can help to resolve these problems by providing access to high-quality medical services using real-time video conferencing. This combination of medical technology allows the doctors to check the sign and medical history of the patient, evaluate diagnosis, and determine the treatment and prescribe the drugs. In many countries, school-based health clinics or school primary health care cabinets are a key point of access to medical care for children. In fact, telemedicine can help to manage various disorders in school-age children, such as diabetes and obesity. In addition to that, it can help to minimize costs and time spending for visiting medical specialists, so the children can be monitored and treated without missing school education program. On the other side of the life, in the prison, mental illnesses, chronic medical conditions, and other infections have been highly recorded. Moreover, each country spends a significant amount of money to provide medical services for the prisoners. So, what is the solution? It will be the telemedicine. In this regard, telemedicine platforms can help to provide high-quality medical care without low cost and dangers associated with the transporting prisoners. Here are some points of telemedicine application: disaster and quarantine management, rural healthcare, school healthcare, and correctional facilities.
Development countries Despite the recent progress in healthcare, the population of many developing countries doesn't have full access to high-quality medical services. Have you ever heard of telemedicine? Telemedicine provides an opportunity to introduce novel breakthrough technologies in healthcare through the relatively inexpensive and available healthcare system. Medical education. Apart from mere clinical practice, telemedicine has also great prospects for medical education. There is a range of studies in the incorporation of telemedicine into medical education, which demonstrated positive and promising results, showing similar or better efficacy compared to traditional educational approach. All industrial organizations and facilities such as factories, mines, and oil and gas platforms are heavily dependent on the healthcare status of the workers. One of the first industries that implemented telemedicine was the oil and gas industry. Pharmacies. There are several things related to pharmacies, such as first aid kits, drugs, prescriptions and telephone, notebooks, and stethoscope. It has been shown that telemedicine can enhance and optimize the work of community and hospital pharmacies. Primary care and general practice. Telemedicine can greatly improve the work of general practitioner through better and timely communication with the patients. Primary care and general practice. It can help the general practitioner to take care of and monitor a maximum number of patients in the area, particularly in rural locations.
Let's have a look at the benefits of telemedicine. Better access. Telemedicine gives better access to medical health service for patients all around the world. It also allows physicians and health services to expand and reach globally. Reduce financial burden. Telemedicine makes patients to avoid traveling, hence it reduces their traveling expenses. Patients can consult doctor from home so they can save money from not staying at hospital and paying hospital bills. Avoid taking time off. As patients can fix appointment earlier and consult the doctor in online, thus they will not have to worry about taking time off from the work. Free from contagious disease. At hospital, patients with various problems and diseases will be admitted, and some of them might be dangerous, especially to elderly and kids. Telemedicine helps them to stay away from such diseases. Next, we will look at the future of telemedicine. During this pandemic, visiting hospital is impossible for many. Access of telemedicine in every hospitals and clinics in Malaysia will make the patient's life easier as they can consult the doctor from home. Cybersecurity. As the world is moving towards more innovative technologies, the security of it is reducing. Thus, cybersecurity has to be tightened to maintain the privacy of patients. Remote patient monitoring is important for aftercare of patients. Para-telemedicine. Paramedics should be a part of telemedicine as they are the frontliner of life-saving. Now we have come to the end of this video. The current pandemic of COVID-19 is an example to make us realize that unexpected things can happen in future. The application of health informatics in telemedicine have made life a lot easier for those who need healthcare services. Yet, many changes have to be done to improve the quality of telemedicine in future.